Discover with Dr. Dan, the Proactive Health Podcast. This podcast is sponsored by Brilliant, an innovative wellness company. Brilliant helps people live proactively and a healthier and happier life by discovering and using bioactive compounds from plants to help people discover and unleash their innate brilliance. See feelbrilliant.com for more information. Dr. Amie Hornaman, aka the Thyroid Fixer, is a woman on a mission to optimize thyroid patients around the world and give them their lives back using her transformational program, the Complete Thyroid Fix Method. After her own experience of insufferable symptoms, misdiagnoses, and improper treatment, Amie set out to help others who she knew were going through the same set of frustrations and who were on the same medical roller coaster. She grabs your hand, gives you answers about your health that no one has told you, and gives you the actual tools and treatment to fix you. That's the transformational journey. With a focus on optimizing thyroid function and thus optimizing her patients, Dr. Amie looks at each person as a unique individual and not just a lab value. She examines all factors that tie into thyroid dysfunction and thyroid symptoms and treats the person from top to bottom to give them their lives back. So, Amie, we're so delighted to have you on the show here today. This is fantastic.
Thank you so much for having me. It's a pleasure to be here.
So, as the Thyroid Fixer, tell us a little bit about your journey of how you got into this area.
Yeah, for sure. So if we rewind like 25 years, I was competing in fitness and figure competitions and doing fitness modeling. So for those, you have to diet down and your diet is really strict and you're going to the gym twice a day. And I had done plenty before, but this particular one, I started to gain weight instead of lose. And that's not what your body is supposed to do whatsoever. Right. And I knew that. I knew that that's not what my body was supposed to be doing when I was in that kind of contest prep mode. Okay. So I went to 6 different doctors saying, listen, this is what I'm doing. This is what I'm eating. This is how I'm working out. Something is wrong, because you know your body. You know when something is wrong with your body. Mm-hmm. And I was misdiagnosed 6 different times, told you're normal, you're fine, just eat less and exercise more. Oh, man. God, I don't think that's possible to eat any less than I am or exercise more than I already am. Mm-hmm. So this 7th doctor finally diagnosed me with hypothyroidism. And she was the first one to actually feel my throat and say swallow. And so she put me on T4. And, you know, you think, okay, this is it. I have the diagnosis. This is going to be the magic pill, right? This is where my life is going to change. The weight's going to come off. My energy will get better. My hair will start growing again. Awesome. And I gave that about 5 months. It was not working. It didn't work at all. So I went back to her. I did my own research, started plugging away as we all do on Dr. Google or whatever it was at that time. Right. And I went back to her and I said, you know, there's these 2 thyroid hormones, T4 and T3, and everything that I'm seeing seems like T3 is pretty powerful, and that's the active one. And there's medications out there that have them both in it. What do you think? She goes, well, I don't do that. I said, well, I'm going to find somebody who does. What? And that's what led me into functional medicine. So the functional medicine practitioner that I found that gave me my life back, that totally fixed me, he's now my mentor. And that led me down that career path, because I thought, you know what, if I went through this struggle, other people are. And I only gave it 5 months, but I know a lot of people give it 10, 20 years, or they just go with what their first doctor said. You're fine. You're normal. Everything's good. Just eat less and exercise more. You're just getting older. And that's not right. That's not right. No one should have to suffer. No one should have to accept how they feel, especially if you know deep inside that there's something wrong. Right. And that's amazing. It strikes me how so many times the doctors will say, well, they'll chalk it up to something else. You're getting old. Your metabolism is changing. Just deal with it, rather than helping to find a solution. Right, exactly. So we've all heard about thyroid. Give us a little bit about Thyroid 101, what it does, how it functions, and some of the details there. Absolutely. So the thyroid is a butterfly-shaped gland in your neck, and it is the master. So think of it as the master controller of your body. And I don't think we give it enough reverence. I don't think that the medical community looks at it enough as being the one thing that you need, or one of many things that you need to keep your body going. It runs the show. So without a thyroid gland, without thyroid hormone, you will die, which is why when someone has a total thyroidectomy, we have to place them on thyroid replacement therapy because they need it. All of our cells need it. So the thyroid gets a message from the pituitary, and that's where, so we have, I don't want to get too deep in the weeds, so I'm going to keep it real simple. This is how I explain it to my audience and my patients. Mm-hmm. You have the pituitary gland, and it's kind of like sensing, like it's like a feeler, like, hey, is there enough thyroid hormone out here to do the job? Is there enough thyroid hormone in the body to get to the cell to run this show? And if there's not, it's going to start poking the thyroid. So the pituitary is going to start to poke the thyroid and say, hey, man, you have to wake up and do your job. You're not doing your job properly. Mm-hmm. And that's where thyroid stimulating hormone comes from. So it's released by the pituitary to stimulate the thyroid to wake up and do its job. Now, when we measure TSH, that's one of the very few markers, blood markers, where high means low. Okay. So as that number goes up, it's basically the pituitary screaming at the thyroid. It's getting louder and louder and louder and saying, dude, you have to wake up. You're not doing your job at all. Yeah. But as it goes down, then the pituitary is getting quieter. It's basically sitting back going, yeah, things look good here. We don't have to yell at anybody. It's a good day. Yeah. So that's the pituitary sending the message to the thyroid. Then the thyroid makes two hormones, T4 and T3. We mostly make T4, make a little bit of T3. So it's about an 80-20 split. Some people say a 90-10 split. Okay. But it's mostly making T4 because T4 is going to get converted to T3. T3 is the active thyroid hormone. So that's the hormone that goes out and actually connects to each one of your cells. Your cells only have receptor sites on it for T3. And that's going to be important as we continue this conversation to remember T4 is inactive, T3 is active. So that's what attaches to your cells to run your metabolism, allow you to burn fat, grow your hair, put you in a good mood, give you energy through the day.
Okay. So it's this cascade then. Pituitary, TSH, T4, T3.
Exactly. And it starts with the hypothalamus, but I didn't want to get too deep in. So some people have heard of the HPT axis. That's hypothalamus talking to the pituitary, talking to the thyroid.
Awesome. Well, we could geek out about the hard science, and we can do that offline. So how do we know we have a dysregulated thyroid?
It usually starts with symptoms. You won't just go to your doctor and have your doctor say, you know what, I think it's time for a thyroid test this year. You're going to have to actually go with symptoms. And those main symptoms that I find people get hit the hardest with in the beginning are the weight gain, inability to lose weight, extreme fatigue, just low energy, can't even drag themselves through the day, hair loss, mood changes, anxiety or depression, heat and cold tolerance. So it could be either you could not stand the heat whatsoever, or you are cold when other people are comfortable. Insomnia is a big one as well. And then we can even trickle into some other symptoms that get kind of like overlooked, like joint pain. Some people have frozen shoulders and they'll attribute it to an old injury, but really when we fix their thyroid, that improves. And they're like, hey, what happened there? Yeah. But the main symptoms, I would say, weight, energy, hair, mood.
Wow. So it's so interesting how it's all connected. Like you said, I don't think we know that it's a master regulator. So interesting. Things like joint pain are connected to the thyroid. So, well, one thing you mentioned, do you think it would be good for doctors to do a thyroid check regularly when you go in before you have symptoms?
I think it would be great, but that's going to be asking a lot of the conventional medicine insurance-based system. Yeah, right. And then, even then, so I guarantee you, most of your listeners have went in maybe to request a thyroid panel, right? Because they had heard something about this thyroid thing and they're pairing it up with their symptoms. And they go in and they say, hey, doc, can you test my thyroid? They're going to get two tests, TSH and free T4. If they're lucky, they'll get free T4. Right. And that doesn't tell us anything. Yeah. Now, if the TSH is screaming, right? If it's way high, then we know your pituitary is screaming at your thyroid. Yeah. And because your thyroid isn't working properly. But what if it's not? What if it's not out of range? That does not mean that you're okay. That does not mean that everything is fine and normal.
Okay. So when it comes to the testing, what type of testing should happen to really get a whole picture of what's going on?
Right. So when you go in to your doctor, you're going to have to lay this out. You're going to have to be specific with your request for the test. So yes, there is TSH, free T4, like we had mentioned, because T4 is the inactive thyroid hormone, but we still want to look at it and see what your number is, because remember, that has to get converted. Then we want to look at free T3, because T3 is the active thyroid hormone. We want to make sure that you are in an optimal range for T3, because if that's low, you're going to be low. You're not going to be functioning. You're going to be in that subclinical hypothyroid state.
Okay.
Then there's reverse T3, which we can talk about separately. And then there's the 2 antibodies. There are 2 antibodies. I've seen many of my patients come back with 1 antibody test. And I said, okay, last time I checked the med book, there's 2 TPO and TG. So it's thyroid peroxidase and thyroglobulin antibodies.
Okay. So
those are the main ones.
Okay. So when we get our test results back, you alluded to this a little bit, comes back and we see the little bars, right, of normal, high, and then we see where we are, a little dot. You talk a lot about the difference between normal thyroid levels and test results versus optimal. So tell us a little bit about that.
Right. So if let's just take TSH for an example, because that lab value range has been debated for decades, actually. TSH used to go from 0 all the way up to 10.
Okay.
And then people in the medical community, even the endocrinology community, said, you know what? I think we really need to narrow this down a little bit more. I think it dropped down to a 6, and then it dropped down to now we're at a 4.5.
Wow.
And we still have people in the medical community, especially in functional medicine, saying, wait, hello, we're seeing people hypo above a 2. Because remember, we don't want that TSH to be elevated. We don't want it to be too high. So that range, whenever you look at any lab value range, it is taken from a huge population, a lot of sick people. We're not weeding out those people who are optimal. We're not getting lab value ranges where we say, hey, this group of people, they're loving life right now. Their bodies are working fantastic. All right, let's take them and get a range. And that would give us a more optimal range. But we don't do that in medicine. We just take this big, wide, huge range and say, okay, if you fall into this range, we're going to call you normal. But you're going to be fine. Send you on your way. But that's not right, because those ranges are really small to where you're going to feel your best.
Okay.
And that's where the functional medicine optimal ranges come in, because we narrow it down. We go, okay, in our practice, we have seen TSH, we really want you like 0.5 to 2,
okay,
even less than 2. And then we can go down the road with all of the thyroid tests saying, well, this is where it's optimal. So free T3, I said, is the active thyroid hormone. 3.5 or above, or at least for maybe listeners in another country, you want it in the upper quadrant of whatever reference range you're given on your labs. But a lot of times people are they're 1 point above the basement line, and they're called normal. And that's not good.
Yeah. So that's fascinating what you mentioned, that the healthy amounts have changed so much. So it seems like there's still a lot in the medical community that we don't really understand. If these levels are changing so much, is there still a lot of debate about levels and what the thyroid actually does in standard medicine practice?
I think it's not so much a debate anymore. It's just a lack of focus, a lack of knowledge, I want to say. And it's just a shame, because I see so many of my patients either misdiagnosed or just mistreated, meaning with medication.
Right.
They might be on not the right med for them. Nobody's checking, nobody's caring, nobody's checking the reverse T3. And they're left suffering, but no one's stepping back and saying, is there more we can do to improve this situation and improve the quality of life of this person?
So how does functional medicine then help to play a role that could potentially address some of these issues that when you go to your doctor, your general practitioner might not be able to do?
So functional medicine looks at the root cause. So number one, we're going to be looking at all of your labs from a functional perspective, from an optimal perspective. So we want you optimal, not just normal. We want you in those optimal ranges for all of those labs. And then we go deeper. Then we say, okay, what caused this? So we know that 95% of hypothyroidism is caused by, it is Hashimoto's. It's caused by an autoimmune condition known as Hashimoto's, where your body is literally attacking your thyroid. It thinks it's a bad guy. So it sends out the troops to basically attack and destroy your thyroid because it doesn't know any better. But we know that most of the time, hypothyroidism is Hashimoto's. Now we go deeper and we say, well, what triggered that? Could it be an underlying infection? Could it be a co-infection like Epstein-Barr virus or Lyme? Could it be that you were maybe on, if it is true hypothyroidism or a dysfunction of the thyroid gland, were you on a medication? Did you go through radiation? Did you do extreme dieting when you were younger in your 20s and 30s and you just trashed your endocrine system?
Right.
So there's a lot of different things that in functional medicine we look at to get the whole picture rather than just testing two little tests and saying, well, yeah, you look good. We look at the whole picture.
Oh, man. How wonderful is that? Comprehensive analysis, which is really needed because the body is a complex system, millions of chemical reactions going on. So I love that we're looking holistically rather than just symptomatically.
Exactly. You have to look at the whole picture. You take into account symptoms because they're important. I mean, that allows us to listen to the patient and say, okay, well, if you have all these symptoms, what are those symptoms tied to? Now, there's a lot of crossover, like low progesterone can be the same symptoms as a thyroid condition. Estrogen dominance could be the same. Right. But all in all, we're looking at all of that and we're saying, okay, maybe it's your thyroid, maybe it's not. Let's look at everything else and rule that out and pair everything together. Okay.
So you mentioned Hashimoto's, and it reminds me of PCOS, kind of an underdiagnosed condition that many, many women suffer from. So talk about PCOS and the thyroid.
I see PCOS all the time in my female patients with hypothyroidism because if we're going back, the thyroid's the master gland. So it is controlling your sex hormones, so your progesterone, estrogen, testosterone, DHEA, it's controlling your insulin regulation. So with PCOS, polycystic ovarian syndrome, and the diagnostic criteria is changing a little bit now, but we don't have to have cysts necessarily on the ovaries, but what we're looking for are those markers of elevated testosterone, elevated androgens in a woman. That will show as increased acne, sometimes facial hair, and then we'll have dysregulated insulin. So we'll go into a state of insulin resistance, pre-diabetes, and that's where the weight comes from. So again, with Pcos, we have women saying, listen, I'm gaining all this weight out of the blue. What's going on with me? Oh, yeah, and I'm breaking out. I look like a 14-year-old boy. Like, what's happening? So that's where it ties together. So sometimes when we address the insulin, which is highly inflammatory, and we address the thyroid problem that may have gone unnoticed or undiagnosed, then a woman doesn't have to go on synthetic birth control to control her PCOS. Guess what? We fix your thyroid, we address the insulin, and boom, all your symptoms go away.
Wow. So I love, you mentioned insulin. And you and I, we love to geek out about insulin. Yeah. So people would be like, well, insulin, that relates to diabetes and eating and diet. What, insulin and the thyroid? What's going on there? That's crazy.
Yeah. So, like you and I did talk about, insulin is so inflammatory. Yeah. It really is, I believe, and I know you believe this too, that root of many, many diseases. I won't say all disease, but it's the root of many, many disease states. So when insulin is high, the body is in an inflamed state, and there is no way your thyroid can work properly when your whole body is inflamed, when it's basically fighting that inflammation. So insulin naturally gets dysregulated when the thyroid is not optimized. So when we optimize the thyroid, normally we see insulin kind of come into balance a little bit more. And then there are some other herbs, supplements, things that we can do, dietary changes that we can do to lower insulin as well. Right. So it kind of works together synergistically. We fix that thyroid and we lower the insulin, and then that lowered insulin allows the thyroid to work better, and back and forth. Right.
So you mentioned a little bit about diet and supplementation. So if people want to take supplementation or some of these other tools to help them, obviously, rather than going to synthetic drugs. What are some tips that you would give our listeners on that?
So if you know, when you're looking at your insulin, if you have an insulin drawn and you have to ask for fasting insulin.
Yep.
We like that in functional medicine, we like it below a 6. Now that range will go all the way, I forget what the top is, 30, 25, something like that before you're even flagged. But if you're walking around with an insulin of 12, 15, 18, and you're not flagged on your labs, you're still insulin resistant. So we want to use things, we can use things like berberine. We can use your product. What is it? Is it the
Connect?
The Connect.
Yeah. Yeah. Brilliant Connect.
Yeah. So we can use that because it has berberine and other magnificent ingredients in it to actually lower insulin. And then it goes back and forth. So you don't need to go drug route. You don't need to get scared because we said pre-diabetes. It doesn't mean that you're going to be on another medication, but there are things that you can do supplementally like berberine, like the Connect that will lower that naturally. And then of course you do have to do the lifestyle changes, the dietary changes too, because you can't be going out and eating McDonald's and taking Connect and thinking that that's going to work. That's not going to work. I mean, it might work a little bit, but it's not. Yeah.
Yeah. I love that. There's no such thing as a silver bullet, right? A lot of times we want to, absolve any of our responsibility for our health. And we expect some magic fix. Right.
Exactly.
So, our male listeners here, they found this fascinating, but I think they're saying, well, maybe we'll tune out. How does this apply to us? So, I mean, are men free from thyroid? Do we need to just tune out?
No, guys, don't tune out at all. So it does, we know that hypothyroidism and Hashimoto's affects more women than men, but the poor guys, my poor male patients that are affected, I have a special place in my heart for them because what'll happen is that your testosterone is going to drop. So if you have a thyroid condition, if you're hypo, if you have Hashimoto's, which does happen, then that will ultimately plummet your testosterone and increase your estrogen. I just talked to a patient yesterday. He's been struggling for years, bunch of different doctors, thousands of dollars spent trying to get optimized, owns his own business, really struggling running a business, keeping his brain working, focus, concentration, energy. And we looked at his testosterone. It's low normal. It's 350. It's at the very bottom, almost bottom of the testosterone range. And his estrogen is elevated. And it's coming from the thyroid. So we are going to fix that and optimize that. But we might also have to use some testosterone replacement therapy here and there just to get that up and give him his life and energy and vigor back. But guys that are affected, it's going to tank your testosterone. It's going to raise your estrogen probably higher than your wife's estrogen.
Crazy. Wow.
Yeah.
When you talk about the master regulator, no one's exempt from that, male and female.
No one's exempt. And I'm not saying testosterone isn't important for women too. It is. So that's another thing that we look at with a dysregulated thyroid is the sex hormones. Like I mentioned earlier, estrogen, progesterone, testosterone. Ladies, you need testosterone too. And you don't want to be estrogen dominant. And you don't want your progesterone in the tank or you'll be irritable. Yeah. So we have to look at that full picture. We have to optimize the master regulator because everything else is going to be off below it if we don't.
Right. So you and I love to talk about the gut, about the microbiome. And when people think about the bacteria in our gut, microbiome, I think everybody's kind of heard that word before. Well, we're thinking it's for digestion, probiotics. How can microbiome possibly play a role in thyroid?
I know everybody thinks when we say gut or leaky gut, they think gut. They think, well, I don't have bloating. I don't have constipation, diarrhea, heartburn. But it's so much more than that because like we said, insulin drives a lot of different disease states. A dysregulated gut will drive a lot of disease states as well. And specifically when we're talking about your metabolism, there is a specific component that we can test for on a stool test that shows your akkermansia. That's one of the biggest markers that I look at on a stool test because if that is low, you are going to be metabolically broken. You're going to be in such a metabolic chaotic state. Your insulin will be high. You will probably have some form of dysregulated hormone balance. May or may not affect the thyroid, but it could.
Yeah.
So all of these different markers in the gut can actually affect your metabolism as well.
Interesting. Again, diet, insulin, who would have thought that it'd be related to the microbiome? Makes sense, though. The research is coming out, shows that the microbiome, a lot of researchers are calling it the second brain, as it communicates with the brain, gut-brain axis, and then, like you said, brain, hypothalamus, pituitary, T4, T3.
Right. Right. So with a dysregulated gut, if we go back to the brain, hypothalamus and pituitary, if those signals start to go off, it might not even be that you have Hashimoto's where your thyroid is being attacked. It could be starting in the gut where your signaling is off. The HPT axis is off. And then we can get the HPA, hypothalamus, pituitary, adrenals. So a lot of people say, I have adrenal blowout.
Yeah.
Maybe you might. Or it could be that your gut is such a mess that the HPA axis is off. So now you're getting jittery and you can't wake up, but you get a second wind at night and you're anxious through the day. Could all start in your gut too.
Wow. This has been fascinating to see the implications. One paper I was reading about thyroid that came out about a month ago that I thought was fascinating is that women during pregnancy who have, thyroid issues, thyroid disease, when they give birth to that child, 5 to 10% of those children end up having thyroid issues. And I thought that was just so amazing how this issue can be passed on, and it affects, even in pregnancy, it affects the babe. I thought that was really cool.
And unfortunately, 5 to 10% of those babies born to a non-optimized hypothyroid mom have developmental delays. So that's one of the many reasons we're seeing an increase in autism. And I just think it's horrible that they're not even a lot of women are not tested properly when they're pregnant. So that's a big message I give to people is if you are pregnant, you go in and you demand all of those tests that we just talked about today, and you demand them multiple times throughout your pregnancy because it is imperative for your baby's brain function.
Wow. And I wonder how many doctors rigorously test for that when they're doing the whole panel and the whole shebang. Maybe that's part of the shebang they're missing.
Right, exactly.
So mental health is obviously a big issue today, during, post-COVID is going to be huge. I was also reading some interesting papers that hypothyroidism is related, thyroid issues in general is related to anxiety and depression.
Absolutely. So many of my patients that come to see me first, when they're in that struggle, they've been through multiple doctors, but they will come with their list of medications. And one of them is always one of those Band-Aids, an antidepressant or anti-anxiety. Now, I'm not saying there are some people out there that genuinely need it.
Right.
Their brain chemistry is off and it helps them tremendously. But let's face it, 8 times out of 10, you don't need an antidepressant. We need to fix your thyroid. We need to fix your hormones. Yeah. And then all of a sudden, we can start weaning you off of that antidepressant or anti-anxiety med. We can use natural means too, like GABA and dopamine boosters and whatnot. But let's look at the source. What's the source? What's causing that anxiety and depression? If it's your thyroid and we fix that and we optimize that, you might be able to get off.
Wow. So this has been fantastic. I think our listeners have gained a greater appreciation for what you do as the Thyroid Fixer.
Thank you. No, I love spreading this message. I love getting it out there. I think people just need to be their own health advocate and demand proper testing. And then don't give up. Don't stop. If you know that something is wrong with your body, and we all do, we all have that innate intelligence that we know when something is just a little bit off with our body.
Right.
You don't stop at the first, you're normal. You don't stop at the first, you're fine, you're just getting older. You keep going, and you might have to go into the functional or integrative space to really find answers and to absolutely get fixed. But you just don't stop. Don't accept it. Be your own health advocate.
Wow. This has been amazing. We're going to include the links so that our listeners can go to your podcast, your website, look at what you do and learn about all things thyroid. This has been amazing.
Well, thank you. It's been a pleasure to be on and to speak to your listeners as well.
Awesome. Thanks again, Dr. Amie. Sure appreciate it. And to all our listeners, thank you. And this is Dr. Dan signing off. Please leave an honest review on Apple Podcasts. We rely on these reviews to make sure we are delivering the best content that is relevant to your interests. Send us a screenshot of your review, and you will be entered to win a $50 Amazon gift card. Send your screenshots to podcast@feelbrilliant.com. That's FEEL brilliant.com. The information presented by guests in this podcast is their sole opinion and in no way represents the views of Discover with Dr. Dan, the Proactive Health Podcast, or Brilliant. This podcast is for informational purposes only and does not replace professional medical care. Please consult with your medical doctor before making any changes in your lifestyle.